Prescott College, then you are definitely in the right place. And we'll just give folks another minute or two to log in. And so welcome everybody. This is the Impact Careers series on community health and well-being. And so we're just going to give folks another minute to join us. While folks are coming in, I also invite panelists, if they'd like to indicate their pronouns. And so the way that you can do that is those three dotted lines that are, if you hover over your image, there's three dotted lines, and you can click on it and you have the option to rename. So you're welcome to identify yourself as you wish. There, and we still have a couple more folks joining us, so we'll give them another minute and then we'll get started. So it looks like we are recording at this point, and so I have a little brief message about that in just a sec, but I think we'll go ahead and get started formally and officially. So welcome everybody. As I mentioned before, this is the Impact Careers series organized by Prescott College, and my name is Robin Curry. I am the Associate Dean for Academic Innovation and the Director of Sustainable Food Systems Programs. And our sustainable food systems programs are like all Prescott College programs in that we're focused on environmental and social justice. So you may be asking yourself, what do environmental and social justice have to do with community health and well-being? Well, the short answer is everything. We launched the Impact Careers series to support all of you and your communities as you seek out, find, or maybe even create what we hope will be meaningful work for you that can contribute to your vision for the future. Today, we're focusing on careers, education, and professional development that can impact community health and well-being. And we're speaking with people whose careers have had a real impact. And I will introduce them all in just a moment. Quickly, I do want to introduce somebody who you'll be seeing in the chat. It's my colleague, Dr. Wendy Sue Harper, and she will be facilitating our Q&A session. So welcome, Wendy Sue.
Hi, everybody.
Yeah, nice to see you.
And it's nice to be here.
Yeah, thank you. So we're joined by lots of other folks who are wanting to be helpful to all of you in your career search. So I'm going to just start with the briefest of brief of introductions, so you know whose faces are on the screen and you'll know when you see them in the chat. So I would like to begin by introducing the most important person. It's your help if you need assistance with your Zoom, or if you have questions and it's not getting distributed. So that's Angelina Smith, who is Associate Director of Admissions. And I'll also go ahead and introduce Maurie Scarpa. Welcome, Maurie. So she's another one of our associate directors for admissions. We have their boss here, so we have Naomi Aid. So she's joined us here also, and we're also joined by Rich Ormond, who's the Director of Career Services at Prescott College. Welcome, Rich. And we're also joined by Casey Miller, who is Director of Graduate Advising. And so pleased that you've been able to join us. So for those of you who have joined us today, if you have questions for anybody specifically, please feel free to be in touch with them in the chat, and you can use them by name and they'll address questions specifically. So before we go any further, I do just want to mention, as you decide how you want to interact in chat, that we are recording this webinar, and we want to thank you for helping us do that, because we'd really like to have this be available for folks who just couldn't be here at 4 p.m. Mountain Standard Time on a Wednesday. So thank you so much for giving us the ability and option to capture this, and also what you put in the chat. So the chat is really what we hope will be a good community space. So I hope that you will introduce yourself and perhaps share a little bit about what your interests are in community health and well-being, and why you joined us here today. So without further ado, I'd like to go ahead and dig in here on the concepts associated with community health and well-being. But before I do that, just as soon as I start sharing screens, we're all going to get really tiny. So I think this is the best time to introduce our panel. And so I want to begin by welcoming Suzanne Pfister, and she is the CEO and president of Vitalyst Health Foundation. So welcome, Suzanne.
Thank you very much.
We're also joined by Dr. Maurie Lung. So welcome, Maurie. So she has a long career and has been engaged in lots of different dimensions in counseling and adventure-based and nature-based counseling. And she brings all of those talents to her position as director of those two programs in counseling at Prescott College. So welcome, Maurie.
Thank you. It's nice to be here.
Yeah, and we also have Annie Reifsnyder, who has joined us today, and she's the executive director of Arizona Serve. So we look forward to learning more about that organization. Welcome, Annie.
Great to be here. Looking forward to it.
Thank you. And we also have Dr. Sebastienne Grant. Seb, welcome.
Thank you. Happy to be here.
Yeah, and Seb is our director of critical psychology and human services programs here at Prescott College, and we'll learn a little bit more about careers that are associated in that area. So I'm going to go ahead and share my screen, and we're looking forward to sharing some more information with all of you about careers in the area of community health and well-being. So I have a check for my many colleagues who've joined me today. Hopefully you are seeing my screen. Yes, for the presentation. Wonderful. So a little bit about where we're headed today. So we're going to talk a little bit about what we mean by community health and well-being. Oftentimes we think about health and health professions, and we automatically think about nursing and physical therapy. And of course, those are critical components in community health and well-being, but it's not just that. And the opportunity to influence all of our health and well-being is possible through a myriad of different careers. So we want to talk about some of those. So we're going to share with you some information that we've gathered using data from MC Burning Glass and also ONET to show what some of the careers that are having higher growth rates. So there's a lot of demand for these careers that are outpacing national averages. And then all those amazing people that you just met, we want to make sure that we have plenty of time to hear about what their jobs are and about how it came to be that they're able to that they came into their jobs and the impact that they feel they're having on community health and well-being, and advice for all of you moving forward in terms of skills and training and spheres of influence. So we're so pleased to have Suzanne Pfister with us here today, because what you're looking at here with this elements of a healthy community, the wheel, comes from her organization, the Vitalyst Health Foundation. And I think that it really does a really wonderful job of showing how so many of us, through our different lenses, can be impacting a healthy community. And so you'll see that, you know, folks like me with an environmental background have a role to play. So you'll see here around environmental quality, folks who are engaged in food, folks who are engaged in community design, housing, community safety, transportation. So all of these different areas have an impact on community health and well-being. And so when we were researching this area of community health and wellness and well-being, some areas of employment popped out as growing at rates higher than average. So to give you an idea of the baseline, 3.7% is the average growth rate in professions in the United States right now. So these areas you can see are growing at higher rates, 15%, 10%, the urban and regional planning at a 6% growth rate. And we also wanted to give you all an idea of the median salaries, but then also kind of the higher end of remuneration for folks who have more experience, you know, towards middle and end of more time in for their careers. And so our panel is here to, we have expertise from many of these different areas, especially if we look in areas of, for example, community health education, and also in social and community service management. So that's an area that Sebastienne's program helps prepare folks for, and Maurie in nature-based therapy and counseling can speak to some of these other areas. And those of you who are less familiar with QR codes, please feel free to direct your cell phone to that area. And then, of course, Wendy Sue will be popping some of these links for you directly into the chat, so you can be learning more about the organizations that we're speaking about. And so, yeah, this is also drawing from Vitalyst's work, thinking about what are these linkages in areas that perhaps you are, you know, passionate about and considering for a future career. So, you know, if you're more interested in the environment and environmental issues, then how does that actually impact health? Well, in all sorts of ways. So if we're mitigating contamination, then that can have a role in educational achievement and a child cognitive development, for example, if there's high levels of lead exposure in childhood. If you are really passionate about organizing and community mobilization and organization and social justice issues, then how does that link into community health and well-being? And so access to care is a critical element, as well as food access and education. And so if you're interested in learning a little bit more about these linkages, then I would highly encourage you to further explore another initiative that the Vitalyst Health Foundation undertook with the Intertribal Council of Arizona. And together, and Suzanne, of course, can speak more to this, but developed this really amazing document. And so we'll pop the link into the chat here for this. And you can also access it from the previous QR code at the Vitalyst Foundation's website. And so this is what emerged out of a very lengthy process around defining a healthy tribal community with that. So with these two partner organizations. And so what I wanted to transition you with, so that you can take with you as we move into the panel discussion, is this broad conception of health and community health and well-being, because they're do tend to be in the United States a more individualistic approach to all of these different factors. But it's obviously, what I hope you walk away from this with is that it's much more complicated than any one element. So thank you for listening into this first part, and we'll transition into the panel discussion here. And what I'll do is I'll stop sharing my screen so that we can actually see our panelists, who we have actually come here for today. And so what I think I'd like to start with actually is with you, Suzanne, because we relied so much on the work of your foundation. And so I wondered if you could perhaps tell us a little bit more about the initiatives that led to the creation of that wheel, and the conception of that for community health and well-being, because I think that as a project was really impactful, and your organization led that.
No, thank you, Robin. Nationally, there's been a lot of conversation about how your zip code's more important than your genetic code. And there's a lot of studies. The Robert Wood Johnson Foundation has done a lot. And we have a map, for example, of life expectancy in Maricopa County, which is where Metro Phoenix is. And within a 30-minute drive, there is a 14-year difference between North Scottsdale and South Phoenix in life expectancy. And you talk about why in the world in a 30-minute drive can it be that different? What are the factors that play into that? And so in looking at that data, it really becomes housing, poverty, justice issues, environmental racism. We had redlining in Maricopa County that limited where people of color could live. And so as we were exploring that, we're a health foundation, but our focus is on being a catalyst for healthy communities. And we said one of our frustrations was that the housing people weren't talking to the healthcare people, who weren't talking to the food distribution people, who weren't talking to the transportation people. And how could we create momentum for collaboration, for cross-cultural collaboration? And that really was where the wheel was born. And it started in 2017 as really a frame to talk about how the interrelationships are so critical, and how housing, for example, is essential to healthcare. And so, and if you look at it again, when you go look at it, it's really very close to a city government. The only thing that's missing is most cities, at least in Arizona, don't have healthcare. And so often cities will say, well, we don't do healthcare. And our response is, you most certainly do. When you talk about community services and senior centers and fire and police and behavioral health, it is all wrapped in healthcare. You just don't think about it that way. And what if you flipped it on its ear and you started thinking about it with a healthy individual being at the center? And so you've seen that migration in really the last 5 to 7 years nationally. And Arizona, especially in its Medicaid program, has been a leader in looking at how to incorporate the social determinants of health, social conditions, And so we've been on that bandwagon. We've been the cheerleader in Arizona. When we launched this, we did over 100 presentations around the state. And that led us to engage collaboratively with the tribes, and that really led to the tribal wheel. So let me stop there.
Yeah, you had lots of nods on your head from the other panelists as you were as you were speaking. I think I do want to ask one quick follow-up question before I go to follow up with some of the nodding. So when you said that you presented the hundreds of meetings as you were rolling out, so how well was this framing and concept received?
It's been an evolution. When we started, I had several. I remember one vivid meeting in Buckeye, Arizona, where I had the fire chief with his arms locked in and like, well, I don't want to be here. I don't want to talk about this. We don't do this stuff. And the community development director saying, I have all these ideas. So you start with the early adopters, as you do with any movement, and you work from there. And I joke that my strategy is infiltration. You go to where the places that don't likely expect this, the business community, the faith community, healthcare itself, hospitals. And we've worked in all of those sectors to try and show how it directly. There was a great line in Health Affairs where a patient said to the doctor, if you really want to help me with my blood pressure, help me with my utility bill. Because if it's 90 degrees inside my house, you can throw all the meds at me you want, and my blood pressure is not going to go down. So creating those stories, using storytelling to create that message became very, very critical for us.
Yeah, thank you so much. I think I'd like to transition to Annie, actually, because I saw you nodding your head quite a bit while Suzanne was speaking, and so I wanted to ask, what resonated with you with, either the wheel or what she was, the contents of the wheel.
Yeah, I think just the communication between, different community entities is critical. And so Arizona Serve is an AmeriCorps program, and we're a program at Prescott College. And what we do is we add kind of human capital to nonprofits and government entities that are often understaffed and lack capacity building forces, which is what our AmeriCorps members are. And those individuals in return get leadership development and an ability to kind of learn what it is about the nonprofit sector that is really unique and different. And so I think the communication between entities is something that we have definitely, I think, pinpointed as kind of a point of difference of our program, because we do have individuals that are with the Southern Arizona Community Food Bank. We have individuals that work at Yavapai Community Health Services. We have folks that even do youth programming at the Arizona Philharmonic. So it's a little bit of everything, and each one brings kind of a different aspect to that community health that often reaches people in poverty in different ways. So really kind of piggybacking all of those services and kind of in a virtual sense, but in more of a physical sense, putting everybody in the room that they need and making sure that all those entities are talking to each other, I think is especially important in the work that we do.
Yeah, thank you, Annie. Annie, I wondered if you listed off a lot of different organizations where folks are embedded, where your volunteers are embedded. And so I wondered if you might be able to share a little bit more information about a project or an initiative that your AmeriCorps volunteers are engaged with that you think is having a role in impacting community health and well-being.
Yeah, so I think, obviously our, poverty indicators range from, human health and services to working with the elderly. I think something that has been especially important for us is just education. So a lot of the work we do is enhancing services within elementary schools and middle schools and high schools, and specifically throughout the COVID-19 pandemic, offering outdoor place-based education that can take place in a safer environment. So we actually provided a lot of resources to the Community Nature Center, which was a joint project between the city of Prescott Unified School District, and Arizona Serve, that created outdoor classrooms, and AmeriCorps members provided staffing for those outdoor classrooms. And that was actually expanded into community education models, where parents that were arguably teaching students at home during COVID-19 could come and interact with nature. So I think the pandemic has caused a lot of pivoting to occur, but in many cases that pivoting, I think, gave more unique opportunities to approach community health and well-being from different angles and perspectives. And now we're starting to see funding and dollars go towards those initiatives, which is, I think, even more compelling, and individuals wanting to go into those careers. When we do recruitment, we do it actually at a national level, and all of our outdoor kind of environmental place-based initiatives, whether they be with the Highland Center, the Community Nature Center, or the Sustainability Center or Green Mountain Sustainability Center at Prescott College, all get a lot of applicants that are interested in wanting to go into those fields.
Yeah, well, I think this is the perfect transition to you, Maurie. So, Maurie, perhaps you could talk to us a little bit more about nature-based and place-based counseling, because that's what your career has been built around. So Annie's talking about, maybe what's some more entry level exposure into that kind of career that, you could have as an undergraduate or a recent graduate. I should have said recent graduate for AmeriCorps placements, but perhaps you could speak with us a little bit more about your area of expertise.
Yeah, I feel so lucky to have a job that I feel so passionate about, both with my role at Prescott College that is overseeing the nature-based and adventure-based counseling programs for people who want to be a licensed counselor, as well as running my own counseling program in Florida, and where we have lots of exposure to adventure, and then doing some international work. And when I think about some of the nature-based counseling programming that we do, we have two really big impacts. One, we're looking at healing, and that's what you traditionally think about with mental health counseling, but we're also looking at restoration of dignity. So when you're looking at working with marginalized populations or interrupting systemic oppression, nature-based counseling has a role in that. So from some of the very tangible programs, so for example, clients at our program here in Florida are only charged $5 for a session, where they might be sailing, or they might be doing estuary planning, or they might be doing family tree climbing, to paying attention to how we collaborate with other organizations. So we have a collaboration with someone who does canoe rental, and in exchange for giving us canoes, then I do an annual training for them for how their staff can be able to respond to emotional crisis when people are out in the canoe. So we're really integrated into our local community. We're hoping that not only do you have a nature-based counseling session when you come and visit us, but you then know what are some of the environmental access points around in our community, and who are those other community collaborators. So it's very tangible when you're thinking about how does nature and mental health really impact each other. Of course, there's lots of research that shows that just being outside improves our mental health. My favorite study right now is that a 2-mile walk a day outside creates the same amount of chemical in your brain as an antidepressant. Of course, if you're depressed, it's hard to get out of bed. But if you're meeting with somebody, you're more likely to meet with them. And so again, we're reintroducing that idea of meeting with people outside and doing this work in an outside setting. So from that project to even bigger projects, another one that I've been really excited about this last couple of years is what we've been working with both kids in foster care, but also foster care parents and foster care caseworkers. So again, you have that broad range of how you might interact to get adventure therapy programs into their homes. So we're in 13 different counties right now in Ohio where foster care families and caseworkers and field workers are doing adventure therapy in a home-based setting, including, you know, being out in nature. How do we play outside? How do we look to the out of doors, not just for coping strategies, but for being able to thrive in our community? And of course, a lot of this is informed by the trauma-informed pieces. So how do we address and navigate that in our world? And then internationally, I'm working with a program in Ireland who reached out, and they're working with people who are in migrant types of situations. And how can we connect with nature and use that in a very healing way? And again, that restoration of dignity. So I just see like it's just such a huge span. So when I think that people come into our program in the nature-based or adventure-based counseling, they might be thinking traditional wilderness therapy in this, 30-day residential setting for teenagers. And it might look like a home-based setting with foster care to, being out at the beach with a family to, working internationally. There's just so many different things that you can do or ways that you can access the power of play and adventure and nature for both personal healing, family healing, community healing, and again, that restoration of dignity.
Thank you. I think you've given.
I was like, I hope I answered your question. Now I don't know.
Like, oh, I could do that. I could do that. That's related to that. No, thank you very much for that. I think Seb was nodding again in agreement. And so, one of the things I'd love to hear from you, Seb, about with students that you encounter in your program is, what kinds of jobs do students who are in the critical psychology and human services program access, and how are they making their impact on community health and well-being?
Oh, sorry. Yeah, so I actually had to write some down because our students are doing so many different things, and I get this question so much, and I'm like, oh, what are they doing? So first of all, a lot of our students come into the program because they're already working in the human services or social services field with an undergraduate degree, and they're looking for like a critical reorientation to that work, which really looks at the relationship between societal systems and well-being. So we're not just entering and seeing individuals as having these individual struggles, but really looking at, I think what all of our panelists have been talking about, this relationship. So let me get my little list here. So I think there's two ways to talk about what our students are doing. The first one is like the types of positions that people in this field are getting, which are things like director of a nonprofit, mostly working in nonprofit sector, grant writing, nonprofit consultant, public policy consultant, outreach coordinator, trauma, disaster relief worker, things like that. But I think maybe it's more interesting to talk about the types of organizations that our students are working with. So we've got people working in schools for at-risk youth, working in organizations that serve adults with developmental disabilities, organizations that provide family support services. So things like child protective services and disabilities advocacy. We have a student who's working as an interpreter and advocate for the deaf community, and also one who's working as an advocate for people on the autism spectrum. We have people who are working to support immigrants and refugees, people who are doing crisis intervention work, people who are working to support others experiencing homelessness, working with veterans doing re-entry back to civilian life. People working in just different types of mental health support, including residential mental health support. We have one who's a labor union organizer, Also, some people doing really cool stuff with wilderness and adventure-based therapies and nature-based therapeutic work, and people working with addiction and recovery. There are a lot more, but those are the ones that I could actually remember today. And unfortunately, I think that, as you said, Robin, these are all growing areas. Like it's, I think that we would all love to be put out of business because all of a sudden the world is a healed and just place. But it seems like struggle is increasing, or maybe our awareness of it is increasing. So there is increased, positive job outlook in all of these areas.
Yeah, I really appreciate that framing, because I think, there's that tension, of course, because, we all care so much about, the students that we work with and the issues that we're interested in. And on the one hand, we want students who have passions in those areas to be connected with the kind of career that has meaning for them and impact for the community. So you want those available, but you also really would like to actually see healthy communities already, as a reality. So I really appreciate you acknowledging kind of that tension that we're talking about today in this webinar. And I think so maybe what we'll do is maybe we'll keep on the path of acknowledging the reality that we're in the middle of a pandemic, which has only emphasized areas where we have health inequities. And so, maybe, we just go with the regretfully, we do not have uniformly healthy communities, and we're all struggling a little bit with community level well-being and individual level well-being. And one of the things that I think is so important is that these are areas of profession and influence where we really can't afford to not get it right. We have to get it right. And so with that kind of burden in some ways, but obligation and ethical imperative in the work that folks are doing. I want to direct this next question to Suzanne, because Suzanne's organization is so also connected with so many organizations and, hundreds and hundreds of meetings on an annual basis. I mean, it may even be into the thousands, because this is a very organized and busy person. But so the question is really, are there moments at work when you find yourself saying, like, gosh, if folks just had better skills in blank, so I'll let you fill that in, we could really improve community health and well-being. So what are those gaps that you would advise, folks to commit some time to professional development and skill building around?
It is, we've all touched on it. It's the interdisciplinary nature to step out of your silo, step out of your degree program, and to go join the local Rotary, places you never thought you'd want to be, but where you can have influence and shape the trajectory of traditional departments, whether it's at cities or in the community. But getting involved in pulling in unlikely partners can have just extraordinary benefits. So it is really not being stuck in your department or your silo, but asking, can we bring in this cross-discipline, and every quarter have a cross-discipline discussion.
Yeah, thank you. I think, Maurie, I'd love to kick that exact same question to you. So, are there moments in your work, because you also talked about a bunch of organizations that
time.
you're partnering with, that you're like, if only.
Well, so one of the things I love about my work is that it is a dynamic, continuing space where we're learning all the time, not just forced because of licensing, but, I encourage both the people that work with me and myself to make intentional decisions about that. And so I happened to have a meeting with my interns this morning, and I asked them, what did they feel was the gap, or what did they feel like I gave them that they didn't get in schooling? And individually, they all said interpersonal neurobiology. Huge, big word, but this idea of that those interpersonal skills and how our brain responds, and how both those automatic and the behaviors that we do that we're not really aware of, that we think are informed by one thing but are really being informed by another thing, that if we can understand that interpersonal neurobiology, we're able to meet people in a different way, we're able to hold compassion for people in a different way, we're able to see that the limits that we're placing on ourselves might not actually be limits. And so that piece, to me, I don't know that I would have said that just if you asking me, but when I heard my 6 different people have the same response, it really made sense of this gap of knowledge that impacts how we maneuver within our fields. So understanding some of those pieces allowed me to make a collaboration with the canoe launching place, or allow me to think about, well, how would I do adventure therapy in a home when I'm not there, or the counselor's not there? So that ability to, it's not really think outside of the box, it's really that ability to find creative solutions to those potential barriers. So probably not the answer that you expected, but it is rooted in what people said. So
yeah, no, I didn't expect any, but I'm so pleased to hear your answer. And it's interesting to think about, okay, then now how do we help people skill up around that? And how do we help people, continue to develop what they need to be successful, since that's a noted gap. So that's our challenge, right? As educators now we got to do something about that. so Annie, I have a similar question, but with a little twist. What do you hear from your AmeriCorps volunteers as the skill sets that they found most valuable? What did they find that they were relying on the most in their placements?
Yeah, so just small change, AmeriCorps members, and I veer away from the word volunteer, because
Thank you.
I think when you think of the nonprofit sector, it's often called the volunteer sector. It's often called the third sector, and I think that kind of diminishes the value and the importance that is placed on nonprofits. And maybe that's how I'll indirectly answer your question. I think, the academicness, if you will, of nonprofits is a fairly new academic field. There haven't been very many nonprofit master's programs or individuals wanting to do, doctoral research on those subject matters. So I think something that we really push our AmeriCorps members, and me as well, in a co-learning environment, is to get kind of a broad perspective, like Suzanne was talking about, of many different things. So to use maybe an analogy that people would understand, if you run a small town newspaper, you have to learn how to take the photos, you have to learn how to write the copy, you have to learn how to edit, you have to learn how to do the publishing, you have to then deliver the paper. And I think when you're working within nonprofits, you do need to know a little bit of everything. And I think, those, the hard versus soft skills can both be taught, but I think it's that experiential component that we offer our AmeriCorps members, and quite frankly is the cornerstone of what Prescott College offers, to really get in and learn while you're doing it, and then provide readings and context to the skills that they feel like they're developing. So I guess that's an indirect way to answer your question. So
Yeah, no, I think that's pretty direct, because what I'm hearing from you is as advice, and I'm just paraphrasing, so correct me if I got it wrong, but the advice to folks is really seek out experiential learning opportunities, and have those be ones that are mentored, because what I'm hearing from you is also the value of having that, being mentored, a little bit of guidance, so you are developing the soft skills at the same time as the hard skills.
Totally. And I think community-based experiential learning is something that, I myself am a PhD student here at Prescott College. So really taking, the lesson learned in textbooks, the lesson learned in classes, applying it to kind of case study research and case studies in the community, and really combining what you're learning in books with what you're seeing in real life is something that I think pushes Prescott College apart, and is something that both nonprofits are creating because they have individuals that are really well intentioned, but maybe don't have the experience behind it. So yeah.
Yeah, thank you. And so, Seb, I have a question for you. You touched on it a little bit before, and I meant to follow up on it. But this is kind of around, you'd mentioned that a lot of the folks that you encounter in your program are folks who are already, perhaps embedded in the profession. So, maybe you could talk a little bit about the areas of interest or the kinds of training that folks who come to your program have when they enter, and sort of what some of those motivations were. Why did they, decide to make that commitment of 2 more years to support their learning in critical psychology and human services?
Yeah, so I think the question is like, what do they already have that they're using? And then what if like they don't have, so that they're coming back to school?
Yep. What were their motivators?
Okay, so, it really, as I think a lot of the panelists have touched on already, what people are doing in the human and social services jobs is so vastly varied that, a lot of them have a academic background in psychology or social work or, something related. But they're picking up skills in the job in terms of, interpersonal communication, but also things like data entry. So maybe it's a little bit of grant writing they're doing on the side, like all kinds of things people are doing. I think that they come, a lot of them are coming into the grad program for a couple of different reasons. Either, as I said, either some of them want this critical reorientation to the work, so they need more theoretical grounding for the work that they're doing in order to better understand the experience that their clients are going through. So that's kind of one piece. And then another is often they have plateaued in how far they can go in terms of their work within an organization, and so they may realize that on their own, or they may be working at an organization who actually offers to pay for their graduate work in order to get promotion. So we have a lot of that. So that's the thing for students. If you're already working in the field, or you're thinking about working in the field, talk to your employer about potentially paying for grad school, because sometimes they do that. And so that often involves, if students are looking for skills that will help them kind of make the next level into administrative work, or into more like a director position. So things like being able to evaluate the efficacy of programs, or develop new programs, or get more into the grant writing side of things. Maybe develop even some business skills. So our program is very interdisciplinary, and students will sometimes take some nonprofit management classes, things like that, because that's actually a huge, I think, under-recognized side of this, is that most nonprofits struggle with funding and struggle with being financially sustainable. And so learning how to make our organizations more financially sustainable is a really big part of helping them survive. So some students want to go in that direction, learning more about that stuff. Some students want to go more into the research side of things. So especially gaining qualitative research skills, participatory action research skills to be able to work with community members. I'm sure, as many of you know, the psychology and human services has had a bad reputation for coming in as experts and saying, well, we've done some research and this is what you're struggling with, and this is how you need to fix it, and this is the program that we're going to offer you. In a more critical perspective, is that we want to work with community members to help them identify what their needs are, what would be the best supports for them, and how we can support them in the best. So some people wanted to gain those research skills. So yeah, it's kind of all over the place.
Yeah, but I think that's actually an emerging theme. That's another emerging theme. So I'd like to remind folks who've joined us or who are listening in that please feel free to pop into the chat and put any questions that you have for our panelists, either as a whole or to a specific individual in the panel. So our panelists are with us till the top of the hour. So we're pleased to have them here, and they're more than happy to address your questions. So until I see some, I'm going to keep at it, because I'm curious about some stuff still. So, Suzanne, this one is for you, because we talked a little bit, Seb spoke a little bit to some of the pathways on the journeys for the students that are in her program, but I'd like to hear a little bit about, what led you to the point where you're CEO and president of an influential health foundation here. So, what steps along the way help prepare you for that role?
I've had a very circuitous career, which is probably the best preparation because it turned out to be pretty interdisciplinary. Two things. I had a lot of internships when through college and graduate school. I think I had 7 or 8 of them. And my last internship in graduate school turned into my first job. So getting that work experience, and I also think that helps with Prescott College, where you've got people that may be mid-career or slightly older or have had some work experience. I do think that makes a difference because it makes the academic experience so much more meaningful. I was working at the city manager's office in city of Scottsdale, and as I was getting my master's of public administration, and I was writing papers on the dysfunctional nature of what I was seeing in the office. So that has one thing. I've also, I reflected when you asked, or this was on here, there's a book that Margaret Mead's daughter, Mary Catherine Bateson, wrote called Composing a Life. And it talks about, particularly for women, it is like a quilt. It's not, we have this kind of paternalistic view that you have to, it's a step ladder or it's a stepping stone that you go from one to another. And in many cases, particularly with women, it is more circuitous than that. I ran into some political problems where I became in the crosshairs of 2 people that worked for the same governor, and I had to leave my job because I was young and I didn't have that power. And so you sort of have to dust yourself off and figure out where else to go. So I remember that book really being reaffirming to me that it didn't matter that I may step sideways, and I encourage people to think outside the box of where their career is, because each quilt piece will enrich your life. And so not being so, caring more about the work. I started as a consultant for this organization. And then I went in-house with one of my other clients, and the CEO previous to me said, well, I'll put you on the board and I'll get you for free. I won't have to pay for you anymore. So I served on the board of this organization for about 7-8 years. And then when the CEO position applied, or the first time I wasn't hired, but I applied the second time and was accepted, and I've been here 8.5 years. So it is being open to those diagonals, I guess. It's like sailing. You have to tack to get where you're going to be.
There's so much richness in what you just shared, because it's not just tact, it's try again, and also knowing when to transition also, which is I think important for folks to hear, that it's not linear, it's bumpy. But yet all of that prepared you for your current position. And so one of the things that I'm curious about, this one I'm gonna send to you, Maurie, is really what is a typical day like for you? I mean, I'm actually really I'm curious.
Yeah, I saw that question. I was like, oh, there is no typical day. So I'm going to give you like what my today was. I started my today off on the beach with doing couples counseling, and we were working on connection and also on how to co-regulate with each other. So we were doing some walking and paddleboarding. And from there, I had a Zoom meeting for internship consultation. But even during that, we were doing interactive activities. So it was via telehealth, but we're still doing experiential activities. And then from there, I had an international call with someone from Israel who is trying to figure out the cultural relevance of nature-based therapy in their country. And because that's my dissertation for my PhD was on the cultural relevance of the use of nature and adventure for positive life skill acquisition. So really looking at that, not just that counseling part of healing, but again, that restoration of dignity. So I had that call. And then after that, I was back outdoors with a family doing tree climbing, where one of the family members is in a wheelchair. So I'm really big on accessibility. So we were figuring out how to create some pulleys so that everybody could participate, and everybody was up in the tree. And that I was like, that's most of my day. Yeah. Oh, and then I was reviewing some curriculum and a new book about how to particularly make sure that we're not using cultural appropriation in nature-based therapy. That's a concern of mine, because a lot of it, especially in the United States, has that root positive intention problematic socially. So my days are like all over the place. What I will tell you, that even in my role as a director, I still spend, at least 50% of my time outside. So, and some of that might be like, I might be in a meeting, like right now I'm actually outside. So I might be in a meeting, but I really know that for myself, that connection with the out of doors prevents burnout for me. And so one of the studies that my interns are doing is that we think that, by being out in nature, it's naturally regulating. So you're already co-regulating with your client, regardless of how good your question is. We still want good questions, but we already have that advantage. And I think that by having that type of regular practice, that was the other thing. We did a radical kindness exercise on self-compassion. Having that regular practice, I think, reduces burnout. Like, I don't know very many people that have had a career of almost 30 years where I still wake up in the morning, I'm like, yes, I get to go to work. Like, how exciting is that? I just feel so lucky. So what I would say is, like, there's not really a typical day. I might be doing anything from paddleboarding to presenting internationally. So there is a huge span of how things can look in your world. And one of the things that I do with my interns is paying attention to not only where they have competence, but where they have preference, because you need both competence and preference to thrive in your career.
Yeah, thank you. I think Annie, we have time. This is so hard. I don't know. I only have 2 minutes, so I'm looking at this wonderful panel and trying to figure out how to, how do we end strong? But so I pick you, Annie, and one of the things that I would love to hear from you also is, what one thing. I know it's hard to pick one, but what one thing, has been the most helpful to you in your current position? So as the executive director for Arizona Serve.
Yeah, I think not being afraid to ask for help. I think when you work in a field that's all about helping people, not to shy away from connecting and wanting to work with other organizations and other individuals. I think it's very important to make sure that that's as collaborative as possible. I think the other thing is to make sure that you're coming at community need from not a top-down approach, like not a needs-based, not telling somebody what they need. I think that was said earlier by one of the other panelists, but instead an asset-based community development approach where you're asking the community what they need and they are leading that development and that well-being. I think shifting that dynamic is extremely important, especially when you're working with people with non-dominant and dominant identities. I think that's extremely important.
Thank you. And thank you to all of our panelists who are here today, Dr. Grant, Dr. Lung, Annie, Suzanne, especially for all the inspiration from the work that the Vitalyst Foundation has been doing. And I want to also acknowledge Angelina and Mary. So Angelina Smith and Mary Scarpa for their work in organizing. And so I encourage anybody, listening in to please feel free to reach out to us here at Prescott College because as you can tell, we're a passionate bunch. Concerned about all of these issues, and for those of us who are on the faculty, we have those faculty tendencies, as in we love to talk about whatever is interesting for you in our area. So, give us a call, even if you're just interested in exploring more about what these different components of community health and well-being are. If you have not had the opportunity to explore Vitalyst website and their podcast, actually, I've been catching up on the podcast, and I think you'll find a lot of the issues that our panel touched on today are covered somewhere in one of their podcast episodes. And and I challenge all of you who've joined us today. You heard resoundingly. I picked up on a couple different themes, and one of them is branch out from your own disciplinary area of interest. So if you're really passionate about climate change, then join an organization that may not be engaging in the same way that you are most excited to engage in to learn more and to influence and impact. There was also themes of experiential education, take the internships, try something new, try something different, and that's how you accumulate the skills. And I also heard a theme in lots of areas that was said by Suzanne is it's not linear, and so we wish you all well on your own individual and collective journeys to help impact community health and well-being in your careers. Thank you so much, everybody, for joining us.